Hey guys, it's Dr. Justin Marcagiani here. Today's video is going to be on how to heal a cracked tooth and hopefully, fingers crossed, avoid a root canal. And again, this is a near and dear topic to myself because I'm going through it right now. So I'm excited to walk everyone through it. Keep your fingers crossed for me here as well. All right, so I kind of wrote out a couple of bullet points I want you to follow when you're addressing a cracked tooth issue, right? So first off, you have to look at how did your tooth get cracked, right? Is this like a car accident thing? Did someone whack you where it's totally explainable and it's acute? That makes sense, right? Got it. Is it a poor nutrition thing where your bone and collagenous material are just getting weaker due to poor diet, poor absorption, poor nutrients? In my own history here, when I was 18 years old, I cracked my tooth chewing on a cough drop, and my diet back then was very poor. Since then, it's been amazing, but at 18, cracked up my molar, split it in half, and they cemented it, and that lasted for about 15, 16 years. And about 5 years ago or so, I got a crown. I got a zirconia crown. And that worked fine for about 4 years until I was chewing on a sweet potato chip cracker on Sunday. And I'm like, oh, it's a little bit sore. I'm like, maybe something needs to be looked at with my crown. And it was a hard cracker. I'm like, just a little bit sore, like on a scale of 1 to 10, 10 being the most painful. It was like a 1 or a 2. I'm like, all right, I'll make a mental note on that. And then I noticed in the next day or two, I started feeling a little bit of sensitivity to temperature, cold and hot. I'm like, that's a little bit interesting too. So I went to the dentist. I reached out to a holistic dentist nearby, and I had him do a cone beam x-ray, which is like a 3D x-ray. It's kind of lower radiation, specific on that area. It doesn't affect the thyroid, none of that. So I was able to get that, and I could see there was a little hairline crack. Okay, little hairline crack. And the problem is, once that's there and cracked, bacteria can make its way in and start to irritate the nerve. Hence, the next step that tends to happen with a lot of these situations is you end up needing a root canal, right? That's what I'm trying to avoid. Trying to avoid the root canal, trying to avoid the serious infection. I'll kind of walk you through my thinking on what we're going to do to fix it. So with myself, this was a long-term issue that had happened over 20 years ago, and then the chickens had come home to roost, so to speak, from that injury where that was compromised. Now, the reason why the injury happened, according to the doctor, is the crown. So here's my teeth, all of them, right? They're all smooth. The crown was just sticking just a little bit lower. So when I'd bite, instead of my bite being evenly distributed across the whole side of the mouth, the crown was hitting first, and that was putting more stress on the root of that tooth higher up. And so because that was down a little bit too low when I was biting, the crack came up a little bit higher in the jaw. I mean, I can't even feel any pain. There's no pain here at all. There's no pain here at all. It's just more sensitivity to cold and sensitivity to hot. And it can get a little bit aggravated when I do certain flushes. We'll talk about what I'm already doing and what my plan of attack is. So the first thing I always tell a patient, figure out what caused the injury and make sure the root cause is addressed, okay? Now, if it's an acute accident, you fell, you got hit, car accident, you already know what the issue is. It's not a repeating issue. In my issue, how did I address the root cause? Well, number one, there was previous trauma that had made that area weaker. Number two, the crown was set a little bit lower, and hence it was absorbing more of the force on that jawline versus being evenly distributed. So they adjusted that, and they did the tap testing with the paper and such to make sure it was smoother and being more evenly distributed. So I feel like we have the underlying root cause already addressed outside of that issue being a little bit weaker from the past. So let me kind of pull up my algorithm here. We're addressing the underlying cause, right? How did the injury happen? Check mark, okay? Monitor progress. So I got a cone beam x-ray because I want to see and be able to watch and know what's going on. So if I need to, I can go back and I can see how things are progressing. Are they getting better, right? Of course, I'm worrying about a potential root canal. If my body cannot wall off that crack and deal with the infectious debris in that root canal, obviously that nerve is going to get inflamed and the pain will start to become more unbearable where I will need a root canal if that happens. I'm doing different strategies. We'll talk about it to hopefully hopefully not progress to that point. Now, patients ask me, should you get a root canal? Should you get an implant? My sentiments have always been implants because of the bacteria that can potentially be trapped in a root canal. Now, I spoke with a good holistic dentist who's been in this field for 30 years. He said, hey, Dr. J, I have the same opinion as you up until the last 4 or 5 years ago. I said, well, tell me what happened 4 or 5 years ago. He said, well, they started using laser technology. So after they do the root canal, they would clean out the root canal with a laser. And then, I'm like Austin Powers, laser, they clean it out with a laser, and then they'd seal it up. And so they used to seal it up with all this debris still in there, which was a breeding ground for bacteria. Now they seal it up with a laser first, cauterize it, clean it out, sterilize it, and then fill it. So the laser end stage protocol is allowing all that dead stuff to be totally removed, incinerated, and essentially provide a very sterile environment so bacteria can't grow and so viruses can't live. So that's the big issue. So I'm potentially, if I have to go, I may go to the root canal based off some of this new information. I always said I would go to an implant, but my opinion is changing based off of the best practice protocols with some of these new endodontic procedures for treating root canal. So something to keep an eye on. So next step here, what am I doing for inflammation? So I'm doing liposomal curcumin. I'm doing that. That's very, very helpful. I'm also going to be doing some Boswellia essential oils. Very, very helpful. I have a 200 milligram of gluten-free, dye-free ibuprofen if and when I need it. I've been doing about 200 milligrams a day. That's all I've been doing. I don't really need too much, but I'll pull it out every now and then. So that's a big thing that's been helping. I also have some homeopathics that are helpful that treat nerve pain and bone pain. So I'm doing a couple things just to keep the inflammation down. I mean, I'm talking all day. I'm trying to keep like more bone broths, more collagen, more gentle things. I'm going to go have 5 pasture-fed free-range eggs, make a small little omelet, just so it's gentle. It doesn't hurt to chew, but I just want to keep the pressure and the potential inflammation on the joint down. That's really important. Treating the infection. So how am I treating the infection? So one of the first important protocols that I'm utilizing is I have this awesome Swish de Coco. It is a coconut-based oil pulling formula, which is excellent. It's got a little bit of cinnamon in there as well. So I'll put that in there, and I'm going to flush my mouth, just kind of like swish it around for about 10 minutes. And I'm doing that 4 or 5 times a day. So my protocol is I'm doing this, which is wonderful. You can just do a thing of coconut oil. That's cool too. I'm doing 5 drops of On Guard essential oil. The clove that's in there, very antimicrobial, very anti-inflammatory. It's got some lavender as well. It's got some orange peel. It's got some rosemary, eucalyptus, a lot of good anti-inflammatory, antimicrobial. And I'm also doing about a tablespoon of silver. I have my GI Clear 3 as well. I ran out, so I had this in stock. So I'm doing some silver along with that. And I'm also doing silver intermittently in between. With this concoction, though, I'm rinsing and swishing for about 10 minutes. And I'm spitting everything out, and I'm rinsing my mouth out, because the goal is that the oil is going to pull out toxins and bacteria and potentially harmful compounds. So I'm doing that to decrease the inflammation, decrease toxin load on that root canal, on that nerve, on that tooth, spitting it out. And then in between, I will take some silver by itself. I will take some shots of it in between and flush it a little bit. That's been very helpful. I did a little bit of hydrogen peroxide, which I've seen has been helpful, but it really irritated the nerve. For about 20 minutes, it was just like, it was humming. And so I may go back to that, maybe right before bed, take an ibuprofen before bed just to make sure my sleep's not being disturbed. But I'm trying to avoid that during. I did 1 ibuprofen this morning. I find it's the temperature stuff that gets me. So extreme high or extreme cold, it just takes that nerve and it just aggravates it for like an hour. And if I'm thinking and having a talk with patients, I'm like, I got to keep that pain down. But overall, I've been able to mitigate it. So I'm only on 200 to 400 milligrams a day ibuprofen. The goal is to give my body and my immune system, 1, the ability to heal that crack, and 2, for my immune system to fight the bacteria. Also, I'm doing my GI Clear 4 and GI Clear 1 to help knock down the infection. So 4 has golden seal in there. It has some berberine, some olive leaf. GI Clear 1, the stomona in there, and the yarrow. Yarrow has a history of being very good for tooth infections, which is great. I may also just do a very, very clean, high-quality whiskey where I just sip it over an hour. Clean whiskey has been very good, good history of being a great sanitizer and a natural anesthetizer. So that could be helpful. Again, that's just going to be a quick palliative thing, but I'm doing a lot of other things. My GI Clear 1 with the Stamona is very helpful, and the 4 with the Golden Seal. So I'm ratcheting that up a lot. Now, on the healing nutrient side here, you can see vitamin D and K2 is at a very, very high level, 20, 30,000 of D, and I have an equivalent amount of K along with it. I'm doing a couple tablespoons of cod liver oil, which is very high in vitamin A per day. I'm also doing a lot of vitamin C, some collagen as well, and I do have a collagen, bone marrow, cartilage, bone matrix formula that I'm also using from Ancestral Health Solutions, Ancestral Health. It's just raw material for bone and cartilage, just to provide extra building blocks on top of that. I'm doing a veal bone matrix powder I'm taking right now from a standard process that I give my son every morning, but I'm going to do the bone matrix as well from Ancestral. So that's what I'm doing right now to kind of work on it. So 1, what's the underlying cause? We got it, right? We know what it is. 2, the mechanism's also fixed too, which is the crown being set a little bit lower. 2, we're monitoring progress. We have the cone beam. We're keeping an eye on. I'm going to go back in on Tuesday to keep an eye on it, trying to keep the inflammation down. The goal is that the pain does not get bad enough, so my body has enough time to fight the infection. I knock down the inflammation. I knock down the infection as well, give my body a bump. We're treating the infection like I mentioned. We're treating the inflammation like I mentioned. And then we're providing good raw material and nutrients to work on giving the body the building blocks. Vitamin K2, very helpful at mobilizing calcium into the bone. Vitamin D helps with calcium absorption. Also, it's going to have a major effect on the immune system, which will be very helpful with dealing with the infection. And then, of course, vitamin A is an important fat-soluble vitamin. Doing lots of high-quality grass-fed butter as well, good egg yolks as well, easy to handle nutrition. Vitamin C is a really important building block with collagen. Also doing my True Collagen and the Ancestral Health bone matrix, bone marrow, cartilage formula. So that's where I'm at right now, just giving you guys the update. Again, we'll see. Like, fingers crossed. I know it's a good protocol. I've read some books on it. Robbie Nagel has a good book on healing cavities and root canals. I've seen some of that in his work, just reading online, talking to other clinicians. I've seen this to be, because you're addressing all factors, okay? That's really the key. And the question is your body able to address the issue in short enough time before the pain increases where you have to do something else? So that's kind of where I'm at right now. I may also use my Juve light as well, kind of get my head right up against it like this, so some of the infrared and red light can potentially hit there deeper and help with the inflammation as well. So I just wanted to put that out to you guys. Not saying I'm going to be 100% successful, but keeping my fingers crossed. Appreciate it, and I will report back to y'all on how everything goes. And so just wanted to give you that information. If anyone else is dealing with it, hopefully gives you some good intel on what you can be doing to help improve your dental health in case this is an issue that comes your way. All right, again, this is Dr. J signing off. If you want to get more intel and work with someone like myself that practices what they preach, click down below. You can schedule a consult. Click the thumbs up button, the like button, and make sure you subscribe to get more great content coming your way. All right, guys. I'm going to end today's video without any questions. Hope you guys have a great day. You take care. Bye now.